All right, I think we'll start. So, Assalamu alaikum and good evening, everyone. My name is Zainab Tariq, and I'm the founding president of the Oncology Student Interest Group at Khyber Medical College. And I'm honored to host our inaugural webinar today. For those who followed our journey began as something much smaller. The Warriors Archive was a space we created where we sat with patients, we heard their stories, and we documented what systems often ignore, which is the emotional and cultural realities of cancer care in public hospitals. This is what we were focusing on. So one of those stories, and interestingly, Dr. Sundas has added a slide for her in her presentation. One of those stories was from Dr. Zubia. She's a breast cancer survivor, and her interview, it is available on our YouTube channel as well. It made me question just how far policy often sits from patient reality, especially in our context. So that is when the idea for the Khyber Global Health Initiative was conceived. And actually, the watershed for it was way earlier. So I interviewed Dr. Iram, who is one of our best surgeons at Khyber Teaching Hospitals. Most students here know her. We spoke about data registries and indigenous policies that actually work for our context. So, we read Western literature, we admire it, we cite it, and then we try to copy it for our people. But it doesn't work, right? It doesn't speak to our it doesn't speak to our words, it doesn't work for our workflows or the way our patients understand illness. So I at the end of the interview, I casually asked Dr. Iram if she's working on a registry, and to which she said that she was. So I joined a student team, quietly entering data after classes in her clinic, 4 to 6 of us with our laptops open. And that is when I started wondering if improvised systems actually work long term, because we were simply taking case files and we were entering that data onto Google Forms. And we had like a trainee who would like guide us on what the right the right grade is for this type of cancer, or if it's like what like a triple assessment means and stuff like that. So it was a great learning experience, but it did make me wonder if improvised systems such as this work long term. And another thing that I realized here was that students, if they're trained and they're trusted, which I'm really grateful to Dr. Iram for, they don't have to be bystanders. We can improve our systems and not inherit them passively. So that is where like I wanted to, speak about it and maybe discuss it in a very casual setting as today. So this is around the same time when I connected with Dr. Sundas. Dr. Sundas Saboor is a graduate of Khyber Medical College, which is the primary reason I reached out to her, because I believe that she understands our challenges and our problems at Khyber Teaching Hospital. And she's a physician from Pakistan, and she is a Harvard trained MPH and a PhD student at the University of Michigan, whose work spans AI, global health, and Muslim women's health with clarity, strength, and purpose. So I reached out to her, and she was very kind to have accepted our offer. And from there, she reached out to the Afghan Ministry of Health for their experience on CanReg 5 and cancer registries and low resource settings. And that is where the idea sparked for using Afghanistan's implementation of CanReg 5 as a case study for indigenous policy for KPK in Pakistan. And that brings us to today, a conversation about navigating health system barriers in conservative, resource limited settings, something we experience every day and something Dr. Saboor has built her career around addressing. So, Dr. Saboor, welcome, and we're truly honored to have you with us. Over to you.
Thank you so much, Zainab, for the invitation, and I'm super excited to have my presentation. Is it okay if I start, or do you want me to say something else? Should I just start?
Yes, you can start.
Okay. So, assalamu alaikum, everyone. My name is Sundas. And before I get into presentations, I just want to give a disclaimer that whatever views and opinions that I express in this presentation are solely my own. They do not reflect the official policy or position of any institution I'm affiliated with. I'm a Khyber alumni, I'm a Harvard alumni, and currently I'm a PhD student at University of Michigan. This presentation is solely made by my own personal capacity as a public health professional and is intended for informational and educational purposes only. So I would like to start with the presenting this short paragraph from a book that I recently came across, and I will give you like a few minutes just to like read it. Okay. So this is basically from a book which was written by Dr. Zubia, which Zainab mentioned. The name of the book is Cancer, Iman Aur Umeed Ka Safar. She was a brave breast cancer survivor, and she shared her uplifting journey of confronting this cancer in this book. She was assisted by Dr. Iram Sabir, who is a general surgeon, and also a Professor Dr. Muhammad Tariq, an oncologist at Khyber Teaching Hospital. And their dedication and support were very pivotal for her healing process. Her story is a reminder of the incredible strength and resilience that we can discover within ourselves, illuminating the importance of hope and perseverance during the toughest times. Moving on. Does anyone know who he is? I can't see all the participants. So, Zainab, you're going to help me with this.
Yes, we know him.
Okay, cool.
At least those who were part of the volunteering event that we did at Khyber Teaching Hospital, where we got to meet cancer survivors. And he's one
Okay.
of Dr. Tariq's patients for us.
Okay. So his name is Azizullah Khilji. He was a 25-year-old final year medical student, and in a remarkable medical breakthrough, Khyber Teaching Hospital treated the first ever osteosarcoma bone cancer with a high dose methotrexate in 2022 with limb preservation. And he was also treated at Khyber Teaching Hospital. So idea of sharing these stories is that one way we want to personalize what cancer is, because I think when we think about cancer, we think about something which is like outside us, or like which is very foreign. If you didn't have anyone with cancer in your family, it just feels very foreign that, okay, it's something that happens to other people, not to us. But I think giving names to those numbers which happen in a data, I think it personalizes diseases, and it helps us clarify where we are and what we want to do. So moving on, this is what I will be sharing today is like how we can bridge policy, practice, and public health, navigating health system barriers in conservative and resource limited settings. So there are just 4 contents for my webinar. One is I will be giving you a small introduction about myself. Then what is the current cancer prevalence in Khyber Pakhtunkhwa? What is CanReg5 in Afghanistan, and some of the recommendations based on my experience and based on people I've interviewed for this webinar. Okay, so first I'll give my own introduction. So my full name is Sundas Saboor, and I did my MBBS from Khyber Medical College in 2015. Maybe some of you know me, maybe some of you don't, but yes, I graduated from Khyber Medical College in 2015. Then in 2023, I graduated from Harvard T.H School of Public Health with a master's in public health. It was a master's in social and behavioral sciences. Currently, I'm a PhD student at University of Michigan School of Public Health. I'm a second year PhD student, so hopefully I'll graduate in 2028. My research interests are how we can utilize artificial intelligence or like chatbots to educate Muslim women about their reproductive health. So this topic of cancer is very new to me as well. But when Zainab reached out to me for a presentation, I became super excited and wanted to share what I feel, what literature tells us, and maybe we can find a common ground to like help each other with this. So the cancer prevalence in Khyber Pakhtunkhwa. Okay, so interestingly, the first comprehensive report of cancer statistics from 2015 to 2019 was published in 2023, just 2 years ago. So this is very new in Pakistan. The National Cancer Registry of Pakistan published their reports in 2023. And their results suggest that there is like 50-50% chance of males and females getting cancer. So it's not like any female disease, it's not a male disease. It's a disease which is equally present in both males and females. This report shares that province wise, 45% of cases were from Punjab, 26% of cases were from Sindh, 17% of cases were from Khyber Pakhtunkhwa, and around 4% cases were from Balochistan. So my question to you is, why is it 17% in Khyber Pakhtunkhwa? Can you think of any reasons, like why it's 45% Punjab, why it's only 17% in Khyber Pakhtunkhwa? If anybody would like to share in the chat, or maybe. Okay.
Those who would like to answer, they can either raise their hands or they can write it in the chat box.
Okay, yeah. If it's comfortable for you, you can even write in the chat and like, okay, less junk food. Okay, that's one option. Okay. Anyone else? Okay, just hold your thought. Maybe we can move forward and see, what. So are we better than Punjab? That's why we have only 17% of cancer cases. Zainab, you can reply, on behalf of them. Like, what do you personally think? Are we better than Punjab?
No, we're definitely not better than Punjab. I think. Oh wait, somebody has replied actually. So Hafsa
Okay.
Shah says it's unreported.
That can be one of the reasons.
Uzair says people don't go to hospital for diagnosis because they don't know about it.
That's also true. So I think a lot of things depend on just the cancer prevalence. And I think we'll move on with that. Are we better than Sindh? Yeah, maybe not. But one of the major reasons that we think that we have only 17% of cases in Khyber Pakhtunkhwa is that there's no data registration, collection, or evaluation. So if you see in the previous slides, I mentioned Punjab and Sindh, and I think if you know, one of the biggest cancer hospitals in Pakistan is Shah Khanum Memorial Cancer Hospital, and they have their own data registry. So they document and record the cancer cases. But why is it only 17% Khyber Pakhtunkhwa? The only reason that I can think of is that because we don't have any data. So just to create the argument that why we need data collection, why we need data evaluation and registration.
Also, sorry that I had to cut you here. Another very interesting thing about Shaukat Khanum is, this is something that we discussed in my interview with Dr. Iram. So the thing with Shaukat Khanum is that they take very few cases. They only take, I think, grade 1 and 2 cancer. So basically, whatever data they're presenting or whatever data they have is for patients who present with grade 1 and 2 cancer. If I'm not wrong, somebody can correct me. But the point is that they take very few patients who have like a higher chance of prognosis, better prognosis. So those who they reject, they're not really part of the registry, right? So their numbers are never counted.
So you can say, like, in public health terms, there is a selection bias for this.
Exactly, yes.
So I think keeping all these things in mind, we can move on with like why this is an issue in Khyber Pakhtunkhwa. So unfortunately, I was only able to find very few literature which was specifically targeted for Khyber Pakhtunkhwa. And what was shared in those literature was that the systematic data collection for cancer in Khyber Pakhtunkhwa started in 2017. So if you count, if my maths is good, it means it's like maybe 9 years that the cancer data collection has started in Pakistan, in Khyber Pakhtunkhwa. So currently there are only 3 registries in Khyber Pakhtunkhwa. One is the Cancer Registry and Clinical Data Management section at Shaukat Khana Memorial Cancer Hospital. The other one is at the Pakistan Atomic Energy Commission Cancer Hospitals. And the third one is Chughtai Lab. So these are the only three which collect data, which collect information about cancer. And this brings us to some stats which were present in those studies. So you can see specifically in Khyber Pakhtunkhwa, one of the most common cancers among women are breast cancer, and among men are prostate cancers. If we think about children in Khyber Pakhtunkhwa, the most common cases are bone tumors and non-Hodgkin's lymphoma. And so one of the reasons that we wanted to do this presentation is also because there's no cancer registration in Khyber Teaching Hospital or any government hospital of its own in Khyber Pakhtunkhwa. So the only data that you're getting from any literature is either through the Shaukat Khana Cancer Memorial Hospital or from the Pakistan Atomic Energy Commission Cancer Hospitals or Chughtai Lab. But I think it's time that we move on with this and see if there can be something which could be made in Khyber Teaching Hospital, because it is one of the biggest teaching hospitals in Khyber Pakhtunkhwa, not only in Peshawar. So I think we should get our heads together and brainstorm some ideas of what we can come up with. Why is cancer registry important? So data from cancer registries is an effective tool for setting goals, monitoring progress, and evaluating cancer programs outcomes. A cancer registry is a system for collecting patient data that is then compiled into a summary of the patient's history, diagnosis, treatment, and status. The main function is to register in a complete, continuous, and systematic manner the personal characteristics of all cancer patients, as well as clinical data and the anatomical pathology of each malignant tumor for further analysis and interpretation of the information. So I hope the word cancer registry is very clear in everyone's mind what it means. Okay, so why I choose Cancer Registry 5 in Afghanistan as one of the case studies is that when this topic was given to me, I started looking at literature of what has been written about Khyber Pakhtunkhwa regarding cancer. And as you can see, there's very limited literature. And then an article came up, which was written recently in Afghanistan. And I connected with Dr. Mihan Abdullah. He was an MD from Kandahar University. Then he did his MPH at University of Missouri, Columbia. He is the founding manager of cancer diagnosis and treatment at the Ministry of Public Health Afghanistan. He's also the founding head and executive director of Afghanistan Cancer Foundation and National Cancer Control Program of Afghanistan. I got connected to him because he is a research associate at Harvard. And so I thought to talk to him and see what his experiences were in Afghanistan, because I feel most of the things are very similar in Afghanistan and Pakistan. And with all the conflicts that happen in Afghanistan, if Afghanistan was able to make a cancer registry, why not Khyber Pakhtunkhwa? So these were some of the reasons that I contacted him, and we had a very good discussion. He gave me very helpful pointers, and I'm so grateful to him that he gave his time to us and talk to me and discuss whatever he faced while he was trying to create the Afghanistan Cancer Foundation. What were the hurdles that he came across while implementing this Cancer Registration 5? So based on this discussion, the next few slides are basically on that. And so the first thing that I want to share is what is a CanReg 5, why there's so much hype about it, why there is a presentation about a CanReg 5. And so it's an open source tool to input, store, check, and analyze cancer registration. It's available in English, and it's free to use and download with training provided. So one of the amazing things about CanReg 5 is that anyone can download it, anyone can use it, and you can also get training for it for free from YouTube. It's available in English language. So I think this is one of the reasons where you can bring up this argument with the policymakers that you don't need to allot any kind of funding or budget for the software itself because it's free to use. And then what I came to know through our discussion is that there are two kinds of registries. So one is a population-based cancer registry, And one is a hospital-based cancer registry. And there are some other kinds of registries too, but just for the sake of this presentation, I'll discuss two. So the population-based cancer registry, what I understood was that it collects information of cancer from the population. Like if you think about, for example, cancer patients in Peshawar or like cancer patients in Mardan. But the hospital-based registry is all about all the cancer patients in one hospital. So, for example, Khyber Pakhtunkhwa's hospital would be Khyber Teaching Hospital, or maybe Lady Reading Hospital, or Northwest, or RMI. So, those would be like hospital based cancer registries. So, hospital based registries can be translated to population based registry. But first, I think we need to talk about the hospital based cancer registry. Then during during our discussion, we also talked about the active data collection and the passive data collection. Active data collection is people going individually, like physically one by one to every bed and actively collecting data, while passive would be just to analyze the data. The other four parts would be the demographics. So it depends on, like, Cancer Registry 5 has a lot of variables that you can correct. They have a lot of questions about demographics. They have a lot of questions about diagnosis. They have questions about treatment, and they have questions about follow. So it depends on your interest of like what kind of information do you want to use. Do you want to limit your demographics to like only name and age? For example, during our discussion, this point came up that when he was advocating for CanReg 5, he shared that we wanted to collect information about what kind of districts that people were coming from, just to get an idea about the prevalence of a certain kind of cancer. So, for example, if we in Khyber Teaching Hospital want to create a registry like that, then of course we would be interested if we are seeing patients only from Peshawar, or we are getting patients from Afghanistan for cancer. Are there any certain parts of Peshawar that we are continuously seeing a high prevalence of cancer diseases? Or maybe people are coming from like other parts of Khyber Pakhtunkhwa, which are very adjacent to Peshawar, just to get their cancer treatments. So I think those kind of questions would be important in demographics. Again, it depends on like why are you collecting the information and like what do you want to get out of it. Okay. So the few challenges that he mentioned during our meeting was that in 2013, he said that there was no bed for cancer patients and there was not even an oncologist. Then he also shared that most of the budget that they create in Afghanistan for health are mostly donor based. And these international donors mostly invest in communicable diseases in Afghanistan, like infectious diseases, for example, polio, or like maternal health. But cancer is like not on the radar. The other thing that he mentioned was cancer was not the priority of the government. There were no financial incentives for people to do a cancer registry. Then he also said that when he reached out to hospitals around Afghanistan who used to see Afghan patients, they were not very supportive in sharing data about their cancer patients. And because of the conflict that happens in Afghanistan, he also shared that there were like no EMR, electricity, internet, or workforce. So when he shared all these challenges, it made me think that we in Khyber Pakhtunkhwa also have kind of very similar challenges. Like we are always thinking about funding or financing. We know cancer is not the priority of the government. We know we don't have any money, no financial incentives for people to like work on it. And then there's a whole issue of electricity and internet and like EMR, all those stuff. So based on the discussion that I had with him and some of my own research that I did based on this topic, there were a few recommendations that we discussed. So one is we have to make a case and involve people with authority. So I think one thing that he mentioned was that in his case, what helped was that he did a lot of homework to create a case of why cancer registry is an important thing. So you have to do a lot of advocacy work and involve people with authority. So when I say people with authority, it means people who make policies. For example, the medical director of the hospital, principals, faculty. So anyone that you think can be an authority, you need to involve them. And then I think nowadays a lot of the hospitals think about in the scenario of like finances. So like budgeting, how much something would require money. And I think if you make an argument based on finances purely, that, this is how much it's going to cost, this is how much it's going to help. So like kind of creating that policy brief, which is very brief, but it's very descriptive of like why it's important. The other thing that we also discussed was like finding supporters and utilizing social media, cancer survivors. So I think I started my presentation with cancer survivor stories too. And I think those are the people who can be great advocates for that, because if they can create an argument that if they had better data collection and better data evaluation, cancer would have been diagnosed very early, or maybe they could have a better treatment if there was more data. And then creating a full budget in a policy brief. I think I did discuss that with details about financing on all aspects of the registry. So, for example, how many people would you need to hire for data collection? How much would it cost for the computers that are involved in data collection? Uh, uh, what would be the salary of the IT people who are involved in this? So, like, kind of everything about it. Like, this is how much that you want, this is how much that you would need. So, like, when you go to someone to ask for something, you should have done your homework. Okay, it's very important. You should know everything about it. Like, why do you need this? How is it going to help? What would be some of the challenges about it? What are the limitations? How much money would it cost? Anything and everything. And I think this is where public health comes in, that when you are designing a program, program planning, I think that's the word that's used, you have to come up with everything that is required. And it's not just, you need something, you just go to any person with authority and say, okay, I need this. But then you should have a plan of like how to implement this too. And I think this is something which requires a lot of work, is that you just don't have to recommend something, you have to work on it. Like, for example, if it's a cancer registry, you say that, okay, we need it, we need money. But then you should have a plan of how, like, when are you going to download the software? When are you going to train people? How much training do they need? How would you keep that check and balance? How would you monitor that? When would you start actively collecting the data information? So I think all these things are very important. And then I think one of the things that he also mentioned was that selecting the right staff, like the regular monitoring with quality checks. You have to select people who are really invested in this, like you, because I think it's really important, because once you leave, for example, if you all are medical students here and obviously you'll leave one day. So then who's going to look after CanReg 5 once you leave? So I think selecting the right staff is extremely important, like people who really understand. And I think there's a difference between people who understand data collection and medical students. So it's not that medical students understand all kind of the ins and outs of data collection, like what kind of data are you selecting, how to write the data, monitor, like you have to do the quality checks if you are writing it correctly. Are people going there on time? Are they collecting information from everyone, or they're just picking and choosing based on like how they feel? So you have to do all those quality checks as well. So as I think I've made it very clear that it's very important to have all these things in mind before you go to someone and talk to them how important this is. A few of the places that I came across that are doing very good work in CanReg 5 are India and Iran. So if somebody, if any one of you can reach out to people in Iran or maybe Turkey, that if they can guide you about it, or maybe they can come to Pakistan and like help you with setting this up, I think that would also be helpful. Then I think as a student, what you need to do is that why you need a cancer registry. And you should know what are the short and long term outcomes and benefits. Like, why are you collecting this data? What are the short term outcomes? Because if you do program planning, you have to create a whole flow chart of like, this is the short term outcome that I'm looking for. This is the long term outcome that will happen, and what will be the benefits. So you should have an idea of like each and every aspect of this thing. And my recommendation, very few, only two, is that start small, is that just take one cancer at a time. Like, start collecting data about one cancer as a start, maybe breast cancer, for example. If you're working with Dr. Iram Sabir, just take one cancer at a time, start taking, information about their demographics, their diagnosis, their treatment and follow-up. And once you're good with that, then I think move on to other cancers and slowly and gradually have others. So like take very small steps. I think that could be something which is doable. And then because I'm an AI person, I love technology and my research is also about how we can leverage it. So I would also suggest students to like brainstorm ideas of how you can use AI to make data collection easy. I think I'll leave it up to you. Like, what do you think is the perfect way to leverage AI right now with the cancer data? And I think literature might help you with that. You can look into, in literature of how chatbots and AI have been used in like North America and other parts of the world to help them with data collection for cancer. So maybe that is something that you can look into. And these are my resources. And thank you. And if you have any questions, I'm happy to help.
Thank you so much, Dr. Saboor, for a wonderful presentation. We're going to wait for 2 minutes and we'll see if anybody has questions and then we can wrap it up from here. Thank you so much. Right, I think I'll start with my question. One thing that I learned from your presentation was that this is something that I did not have in mind at all, because I thought, as a student, you're very Pollyannish, I think, and too hopeful. But I did not have the financing bit in my mind, because I had thought that Cambridge 5 is basically free, right? So I felt that as students, we lacked the training bit, the kind of data that we were entering. Sometimes we'd get the grades wrong, the demographics wrong. Sometimes we diagnose the patient stage 4 cancer when they were just stage 3, in the clinic, and then we'd have to go back and forth from files to our Google form and just make sure we're correcting everything. Like I checked my data like twice or thrice, because I was so worried that I put stuff wrong in the wrong boxes. But like, what exactly do you think? For example, like I'll give you an example. So we're starting with breast cancer cases in KTH, right? So
Okay.
what exactly should the budgeting like consider when we're like designing a budget? Like what should we consider as policymakers?
Okay. So I will share, like, as a public health student, what like you can do is that so there's no generic way of saying that, okay, this is the budget that you need. So I did a few grants here in the US, and for that, I did make a few budgets, and maybe not a lot, but like I have some experience. Is that first you have to think about how many people you need, what you need. So, for example, the way that you're going to do it is that if I were you, what am I going to do? I think I will say that rather than saying, okay, this is like the cookie cut way of saying, okay, this is what you need. But you have to, like, for example, if you hire 2 people to do data collection, right? Then you have to see what is the salary of a research assistant currently in Peshawar, like how much are they being paid. Then you have, then you're going to add that. Then if, for example, here in I know in Khyber Teaching Hospital there is an EMR system. I'm just forgetting its name, but there is a system there. So
HMIS, I think. HMIS?
yeah, HMIS, correct. Yes. So you have some IT staff for that too, right? So you need to go and ask them what their salary is. Okay. And then you see, how much IT people you're going to need, because of course it's a digital computer, it's a digital software, it will crash, right? So you need some expertise with that too. Who's going to look after them? Then, for example, if you hire 2 research assistants from Khyber Medical College to like go one by one and do active data collection, then how much are you going to pay them? Because it's work which is not required for them. You are like literally hiring them, and when you hire them, you need to pay them. So, for example, if you have to pay them as much as the house officers are paid, then how much would it cost, right? Um, so these are a few things that I can think of at the top of my head. But I think if you guys can like sit together and like brainstorm, like what are some of the other people that you need to give money to, any incentives that you need to give. Like for example, you have to also create an argument to the oncologists at Khyber Teaching Hospital of why it's important for them. Like what's the benefit to them, like what are the incentives for them if you get all this data, then, these are some of the ideas that I can think of. But if you have any specific question, you can ask.
No, thank you. I think this is it for today. I'm just going to turn my video on and somebody enter. Thank you so much, Dr. Sundas, for your time. It was a very enlightening session for me, and I hope it was the same for those who attended. For those who attended our webinar, please drop in your names and your email addresses in the chat box so that we can, communicate with you later on after the webinar. And for those who were not able to join, or somebody who would like to see the recording of the webinar, it'll be available on our YouTube channel, inshallah. Thank you so much, Dr. Sundas, again. I really appreciate that, even though, as you mentioned, the cancer was not really your forte, but you went out of your way to, communicate with other professionals who've worked on Candridge 5, specifically in Afghanistan. So I'm really grateful to you for that. Thank you. And I think we'll say goodbye from here. And if there's anything that you'd like to add.
I think I really appreciate what you're doing. And I think it's a very noble thing just to get, out of your comfort zone with all your studies and your training to think about people and like how you can help them. So I really support students with that. And if any one of you guys have any, extra ideas that you would like to brainstorm with me, anything that you're thinking of, I really like students with entrepreneurial thinking who have like any ideas that they want to like implement anywhere around them. I would be happy to help. Zainab, it would be okay if you can like share my email with them. And, if anyone has any questions, I'll be happy to help.
Of course, I'll do that.
Thank you so much, guys. Thank you so much for your time.
Thank you, everyone. Thank you, Dr. Sundas, and have a really nice evening, all of you. Thank you. Allah Hafiz.